Hi, everybody. Welcome to Vital Wisdom with me, Dr. Eli Camp. So, in this episode, I thought what makes a lot of sense is to sort of compare and contrast these models of medicine that I keep talking about. And I've talked quite a bit about what the vitalistic approach to medicine is, and sort of alluded to the allopathic, right, method, or mechanistic or reductionistic. And there's a time and a place for both kinds of medicine. And I think it's really important for us to know that and to know when it is the right time to use either or. You know, I've worked as a preceptor, which is really sort of a teacher supervisor for medical students and new doctors for a number of years. Most of those folks are in the naturopathic field, but I've also worked with a number of MDs and DOs and other types of healthcare practitioners, folks who consider themselves integrative, functional, lifestyle, holistic, and they're really looking for the way to apply things they learn once they get out of school in, extra trainings, how to apply that clinically. And so they end up preceptoring with me. We have to remember something. You might or might not know this, but naturopathic doctors, the naturopathic profession, came from MDs and DOs who were very disillusioned and disgruntled with allopathic medicine. They knew there was a better way. They knew that way. And when we sort of married those practitioners with homeopaths and old-time nature cure practitioners from Europe and Asian medicine practitioners, and it all got sort of put together into naturopathic medicine. Always, and up until a certain point in time, naturopathic practitioners were guided by the vitalistic method, which is, right, I've said, we restore the body to health. We are restoring health to the body. We are not treating and suppressing disease. So once we get past these basics of what I consider the main job of a primary care physician to be, which is to help each person reach their own optimal level of health, then we have to kind of get into the nitty-gritty and, think about folks who come in to see a practitioner who appear to be really sick. They're in pain all the time. They have extreme high blood pressure, joints that are causing pain every minute of the day. Maybe they're covered head to toe with some kind of skin ailment, chronic migraines, chronic fatigue, hyper or hypothyroid, some autoimmune conditions, a type 1 diabetes. I mean, at what point should we employ which kind of medicine? And it's a really good question. The answer for me is always guided by what I know my job as a doctor is, and that is to restore health to each individual person sitting in front of me. One of my mentors, Dr. Jim Sensenig, who passed away in 2019, about this time of the year, he was an old-time naturopathic doctor, a vitalist, a nature cure practitioner, and he always said, if you have somebody who comes in and they are in pain or teetering on the brink of life, that's not the time to sit down and talk to somebody about their diet. First, you have to stabilize the patient, and then you get to work reestablishing the determinants of health or the foundation of health in their body, making sure their body is in its best state to heal itself. And sometimes he could stabilize them right in his office. And other times he sent them to the ER. I can remember a time I was in his office, we were working together, and this guy comes in, I don't remember how old he was, 40s, 50s, with super high blood pressure. In medicine, we call that a hypertensive crisis. Had that guy walked into an ER instead of Dr. Sensenig's office, they would have admitted him on the spot. But Dr. Sensenig put him on the table face down, and he did a few things. He massaged the back of his calves. He did an adjustment. He gave him a homeopathic remedy, and I don't remember which one, some magnesium to drink. And he brought his blood pressure down to a safe range within that 30-minute visit. He did tell him to follow up with his cardiologist, and he created a treatment plan with some herbs, a few supplements, told him to come back in a few days so he could check on him. And when he came back, his blood pressure was still higher than it should have been, higher than what we would consider a healthy blood pressure. But he had gotten him out of that crisis state without drugs and expensive hospital stay, with the basic knowledge of how could he assist the body in its self-healing attempts. But another time, there's this kid that comes in. He was late teens, and he had severe cellulitis, like over a large portion of his body. And that kiddo, Dr. Sensenig sent straight to the ER and scheduled a follow-up with him for a week or 10 days later. And he ended up treating him well into adulthood. We talked about him often when we would kind of do our grand rounds. He treated him from a vitalistic standpoint and got his body into a very healthy place. And, the point is he was in trouble, and he turned to the reductionist or mechanistic or allopathic model to preserve this kid's life. So there's a time and place. It's an important thing. And throughout the rest of this episode, I'm going to talk to you about when you might do which. Hopefully, I've explained the core principles of vitalistic health, but what are the core principles of mechanistic health? As we try to understand the mechanistic or allopathic or reductionist, and I keep using all of those words because it's referred to by all of those words. But it's the same paradigm. They're core principles. And that is that the body breaks or no longer works as it should, and it takes outside intervention to fix it. In addition, this extends into contagious disease, which is viewed as being caused by infectious agents that must be killed or eradicated. It's really that simple. And most practitioners of allopathy know at some level, because I talk to a lot of them, right? I've even taught in many of their medical schools, but they know at some level that the body can heal itself. You can see that happen. If you've ever seen someone get a cut, you can see the body self-healing in action. But they don't learn that in school. They don't learn that in residency. And because they don't learn that, they don't learn about what goes wrong, what happens to make a body less than healthy. Yes, they can diagnose quote unquote disease and pair that to a drug or some other type of intervention. But before you can restore a body to health, you have to know what a healthy body looks like, how it works. And then you can recognize when something is out of whack. In their paradigm, very little attention is paid to this idea that the state of health of the body and how poor a state of health a body is in creates susceptibility, leads to quote unquote disease, and these diagnoses that they are that rules that arm of medicine. Really, to sum up that paradigm, it is a health model rooted in pathology and suppression of symptoms. The focus is on diagnosing, treating specific diseases and symptoms using interventions like medication, surgery, and other procedures. In comparison to the vitalistic model, which is to restore optimal health to an individual body using a variety of therapies and reestablishing the foundations of health. so that body can self-heal as it was designed to do. And when optimal health is restored and the body self-heals, symptoms of illness disappear. We have to remember, whatever model of health you're in, symptoms are the body's only way to let us know something is wrong and what that something is, so that we can get to work fixing what is not working the way it should. Now, you might hear or read, I know I certainly hear it and read it all the time, that the mechanistic or conventional or allopathic model is evidence-based medicine. That sounds really good, right? That sounds like it's something you can trust, but the reality is it's a passive aggressive way of saying that other forms of medicine are not evidence-based. And that's not true. In fact, nothing could be further from the truth. I have some statistics here. In 2023, a global study, Global Scientific Trends on Healthy Eating from 2002 to 2021. This is a big, long title. A bibliometric and visualized analysis. Okay, what did they do? Well, they looked at folks who were eating healthy and putting the proper nutrition in their body. And they wanted to know how much evidence, how many peer-reviewed articles, how many journals, what are people looking at and publishing? You know what they found? Tens of thousands of scientific articles about nutrition. That's almost 20 years. With the number of publications increasing significantly over the last 20. Well, one study reported over 49,000 researchers publishing articles on the topic of healthy eating alone. The journal Nutrients, which is a peer-reviewed scientific journal, was identified as the most productive in the field. Now, it's not just who's doing research. This particular study, and I have the citation if you want it, you can email me, I'll send it to you, but they really wanted to know not just how many were being published, how many articles were being done, but did the evidence show that it makes a difference? And you might guess by now, I really wouldn't have brought that up unless I could say, it's so clear. You don't even need to run statistics, that the nutrition, what you take in, the nutrition of your body, right? The nutritive state of your body makes a huge difference on your quality of life, on developing disease, therefore symptoms of disease, how quickly you heal and how quickly you can recover from illness if you even get sick. So it's a lot of papers, it's a lot of scientists studying, a lot of people producing evidence-based medicine. And naturopathic doctors use a lot of nutrition in their practices. It's a cornerstone for the body because it's the fuel for the body. We are what we eat. Many of the great doctors historically, they identified that. It's been known for a very long time. Let your medicine be your food and your food be your medicine, right? This was in the Hippocratic collection. Now, what else? Was it just nutrition? That was probably the most prolific, aside from acupuncture. But in 2024, just this year, a review in 2024 identified thousands of research articles on the benefits of physical medicine. Another review in 2012 identified thousands of scientific articles about hydrotherapy and its beneficial impact on health. One review study identified over 500 relevant journal articles. Homeopathy has thousands of studies. Acupuncture has over 16,000 scientific publications. Chiropractic, thousands. Okay, these are not necessarily about the model, the vitalistic model, but neither are the allopathic ones. They're about the therapies, the tools that are used. And you can use a tool either allopathically or vitalistically. And many of these studies that I just mentioned and talked about, that's exactly what they're doing. They're using tools to restore health to bodies, to humans, and seeing an incredible difference in outcomes. So it's true that there are a lot of papers published in the allopathic field. The same is true for the vitalistic. The problem is that no one calls it that. Some people call it vitalistic, but it's also known as holistic, complementary, functional, integrative, lifestyle medicine, you name it. So it's categorized under all these different names. And it's the same thing. When we work to restore health to a system, the body is able to self-heal more efficiently. What if we take all the non-allopathic studies and the allopathic studies and compare them, and we say, well, okay, what has better outcomes? The allopathic or the non-allopathic? The answer is absurdly clear. People do significantly better within the model where we are striving to restore health to the system as compared to the allopathic model, with a few exceptions. Well, I'm going to touch on those shortly. It's unfortunate that the mainstream or conventional or major medical system is the one that does not produce the best outcomes for the majority of people with chronic illness. Do we know why? Why, as these, we're smart humans, we're smart animals, we are thinkers. Why would we let that happen? Well, it's all, I'm not going to be a conspiracy theorist here, but if you step out of the system and you look back at it, it's designed that way. What company goes into business to put itself out of business? Why would you give people and do for people something that makes sure they're not your customer anymore? The allopathic system perpetuates this idea that to treat disease as individual things, not connected and related to the state of health of the organism, and use drugs one after the other, if the other because of side effects, you deal with side effects, or surgical interventions that are often not necessary. To me, it's pretty clear that no one is going to be in the business of not being able to stay in business. And so you have to teach folks how to recognize things in a certain way so that you can prescribe something that's indicated for that, and then continue to do that throughout the lifetime of the patient or customer. Like, I think of it in that way. And I'm not the only one. There are thousands and thousands of practitioners who can see this for what it is, especially those in the business of the vitalistic model, or holistic, or functional, or lifestyle medicine. We see the difference. We see what happens. The body heals itself. So the reason I say all that is because the mechanistic approach limits our understanding of health and disease. It has twisted it and warped it into something that it's not, right? These things don't happen to us. They come from within us, and the healing comes from within us, not from without. When we start to see the body as isolated systems that break or are susceptible to infections from something out there, we lose one of the most powerful approaches to health management. And that is that the state of health of an organism directly relates to the symptoms that it exhibits and produces in order to communicate that something is wrong, and therefore letting us know how to fix it. Well, ultimately, the way of seeing medicine from this allopathic perspective creates a power vacuum. It removes personal responsibility and control from each individual, and it creates a system of health in which people become dependent on a system of drug after drug or surgical interventions. For some people, it's easier. Some people just want to take a pill, and they don't care that that pill is going to cause other symptoms, which we also call side effects. This is allopathy, creating another disease state to take the place of the disease state that they're treating. But, you know, the mechanistic approach can lead someone to think that there's inherently something wrong with their body than the reality, which is that their body has simply responded to the way it has been treated throughout its life. And if that makes you say, oh, so you mean I'm the one who got me where I'm at? Well, over 90% of the time, the answer to that is yes. When we think about how vitalism addresses chronic illness differently, because, you know, we really, in medicine, we have acute and first aid, and we have chronic. And when we're looking at the difference between the two models, each system addresses chronic illness in very different ways. In the mechanistic model, chronic illness is seen as an isolated state that needs to be treated, whereas in vitalistic medicine, chronic illness is seen as a culmination of poor health and proper lifestyle and missing determinants of health, with a few exceptions. I know I keep saying that. We'll get there. In the mechanistic model, something like a drug or a surgery is used in an attempt to fix the disease. The person ends up with other symptoms, and because the cause of the chronic condition has not been dealt with, they can end up in this vicious cycle. And in the vitalistic model, the body is restored to health, and it heals itself, and the symptoms are no longer present, not because we've given the body something to get rid of those symptoms, because the body does not have to send the message that something is wrong, so the symptoms aren't needed. And these approaches are almost polar opposite. In fact, they are on two ends of the spectrum, completely opposite. And in the middle is the gray area, is the integrative and the functional and the lifestyle, and they all fall somewhere along that spectrum. As long as the goal is to restore the body to its best self-healing capacity, then the practitioner is practicing vitalism. If the approach is to identify a disease and use drugs to suppress that disease, or surgical intervention to correct something that the body could heal itself, then it's an allopathic, a reductionist, or mechanistic approach. Now, let's talk about some things, outliers here, things that don't neatly fit on one side of the spectrum or the other, right? The strengths and limitations of each model in modern healthcare. So there's a time and a place. As I said when I started this episode and gave you the examples of Dr. S with the guy with hypertension and the kid with the cellulitis, there's a time and a place for each approach to medicine. And as a clinician, I make use of things from the mechanistic model, like diagnostic imaging and labs. There's certain pharmaceuticals that I use because there are no natural alternatives. For example, the big one is insulin for type 1 diabetes, or thyroid hormone for someone who's had their thyroid removed or it's been irradiated and it's not working anymore. But even when I choose to use those tools, it is how I'm using them and what I expect them to do for the body that is different. I'm not trying to suppress symptoms. I'm trying to assist the body in its attempt to self-heal always. If it's not making insulin, it needs insulin to live. If it's not making thyroid hormone, it needs that to live. But I'm going to do more. So let's just, for instance, take insulin. If I may prescribe insulin, and I can do that in New Hampshire where I hold my license. I practice in Oklahoma where it's health freedom, and they don't license naturopaths here. So I can't write for insulin. I have to refer them to an endocrinologist, which I've built my network of people who are super naturopathic doctor friendly, but let's say I write a prescription for insulin for a type 1 diabetic. It's a life-saving drug. There's no replacement for it, but diabetics, especially type 1 diabetics, need to do more than just take insulin. They need to be very careful about their diet and exercise and a number of things, right? Detoxify, take certain nutrients so that they can avoid things like diabetic neuropathy. They can avoid limb amputation. So while I might use the drug, I'm also still working with that person to establish the other conditions that allow their body to be its healthiest. The strength of the mechanistic model is really heroic medicine. When the person would otherwise die from a wound or a condition or a state that they're in, one that the body cannot heal from on its own right then and there, that is the strength of the mechanistic model, to come in and preserve that person's life. Everything else in that model is a limitation easily overcome by employing the vitalistic approach. And the strength of the vitalistic model is to restore health and thereby allow the body to self-heal and restore normal function. Almost all chronic illnesses should be treated by a vitalist rather than by using the mechanistic approach, is what I've seen over the last 20 years. Why might a vitalistic approach over conventional medicine be good for someone or vice versa? When I start working with someone, we always have a list of things that I go over with them, that I tell them, I would send you to the ER for this. And it is those things that I think folks should make use of the conventional system for. And this includes things like an accident in which someone is losing blood rapidly or has broken a number of bones or has very deep and unknown internal injuries, a heart attack, a stroke, sudden weight loss, and increased urination, because we're thinking diabetes. Exposure to lightning, or like get hit by lightning, or radiation, high dose radiation. They've ingested a poison or something caustic to their body. Anytime loss of life seems imminent without an intervention, conventional medicine is going to be the best route. Almost everything else is better handled by a vitalist, especially chronic illness, but even many acute illnesses. And I have an example for you in just a minute about that. I tell my students and doctors and my patients this thing, and this is because it was what I was taught and it cleared everything up for me. Because, you know, when I was a new doctor, I was really worried. What could I handle and take care of? And when did I need to refer? So my mentors taught me to learn to tell the difference between something that would be present regardless of the state of health of a person's body. So it is, regardless of how healthy somebody is, if there's something there going on, that it doesn't matter how healthy they are, that thing right there, that state, that condition, if that would be there anyway, no matter that they're at their healthiest, well, that is something that's likely better handled by the mechanistic approach. But if what you have in front of you is a result of a body that is less than optimally healthy, there's no imminent danger of dying, it's better for them to work with someone who can restore the body to its normal function so it can self-heal. This is important to understand the difference between that. Now, without the medical training, you might not be able to make that call for yourself, but your naturopath can, your functional lifestyle, integrative, MD or DO knows that, as do many other kinds of practitioners. So I promised you a case last week to see how this all sort of comes together in the vitalistic model. But I got an email from Sharon in Pittsburgh, then I want to answer a question she asked first. So first, Sharon, thanks for writing in. And Sharon said, how about something like strep throat? I'm a nurse and I think antibiotics are the best way to deal with that. How would you treat that from a vitalistic approach? So Sharon, that's assuming that the state of health of the body is not what has allowed uh, strep to sort of take up residence. And we all have strep. If we're super healthy, our body deals with it. When we're less than optimally healthy, we have problems. It's a really good question. And antibiotics are one way. This is true. It's not that the antibiotics won't deal with an overgrowth of strep, but they belong to the allopathic approach, the reductionist approach. They're attempting to kill the strep when the body can do this. So from the vitalistic approach, I would do a few things. First, I would take an acute case. And remember, one of my specialties is homeopathy. So this is in my tool bag, and I've used it for more than 20 years because I used it when I was in clinical training. I would take a case for a homeopathic remedy. There's a handful of homeopathic remedies that work really well. And of course, it has to be individualized. I can't say take this remedy for strep. It's not how homeopathy works. It's a case. You have a set of symptoms. You match that to the remedy that can cause those symptoms in a healthy person, and voila, you give that to the person who's actually sick. The law of similars, and it works every single time without fail when the right remedy is selected. Well, not without fail. Once or twice, I've had someone who just doesn't seem to be sensitive to homeopathic remedy. It's probably me not choosing the right remedy, but so that would be one of the first things I do. And that usually works to relieve symptoms in a few hours. But we need to do more to reduce symptoms, right? So I just said we don't treat symptoms. Well, in acute and first aid, there are things that we can do that are not suppressive that will make somebody more comfortable if they're in pain or right something's going on. We have a huge tool bag as a vitalist, as a naturopathic doctor. So I would do external iodine plus coconut oil. I like that as a carrier. I wouldn't just rub iodine on the skin, it can burn. And so I would put in a little bit of coconut oil. You could also use olive oil, and I would rub that all over the outside of the neck. Some old time practitioners would actually paint the inside of the throat with iodine, but I find that kids, most people really don't want to have that shoved down their throat. And I've discovered I don't need to do that. So the outside of the throat, and I would follow that application of iodine within a carrier oil with some contrast hydrotherapy. So a hot and cold towel wrap. So a really hot towel, not to where it burns the skin, but pretty hot, 100 degrees, 110, between 100 and 110. 3 minutes. So I'd wrap the hot towel around the neck and then another towel that's dry to sort of keep the heat in. 3 minutes of hot, 1 minute of cold, of very cold. Even you could say ice water. The cold towel is in ice water. And you do that 3 times. So you alternate hot towel, wrap it up, wait 3 minutes. Undo everything, take it off, put the cold towel on for a minute. And of course, you wrap it up. You do that 3 times, that's a treatment. And I would repeat that treatment 3 to 4 times in the first 24 hours. And then twice a day for 3 to 4 days. They're going to feel better within 24 hours. These protocols were really fast to alleviate pain and help someone not feel like they're so sick anymore. But you have to let them continue to heal. It takes time for the body to heal itself. I would also have them do a saltwater and colloidal silver gargle every 2 hours the first day, then twice a day for a few days. If there's a fever, I have people fast, except a little bit modified. I have people make a homemade veggie broth, no veggies, just the liquid and water, and they can sip on that. It's very nutritive, but I don't want the body having to process food when there's a fever. I want to let the body put all of its attention on dealing with the fever. And if you have bacterial overgrowth in your body, even if it was because your body was run down or not as healthy as it could be, your body still has to deal with it. And so we don't want to take that energy from the healing into the digesting, and you're fine as long as you stay hydrated. We can go days and days and days without food. So I would also likely do a heating wrap, right? Once a day for 5 days. And I'm going to talk about that at the end. How do you do that? I would give them an herbal tincture, maybe, or a tea with things like licorice or oregano and barberry, all known to reduce strep. And yes, there's evidence based publications for that. Finally, I would probably suggest a massage of the lymph glands in the neck. Maybe, you're going to do that naturally while you're putting the iodine in the carrier oil on. So just go ahead and do sort of massage, get things moving in that area. The strep's going to clear quickly. The throat and the gut flora remain intact because you're not flooding it with antibiotics. The body's allowed to do its work and heal itself. It works more efficiently, quickly, because we've assisted the process. So that's how I would approach it from a vitalistic perspective. And really, Sharon, thanks for the question and for watching. I think it's pretty cool that I've got folks out in Pittsburgh watching my show. Be sure and write in again if you have any other questions. Now, the case I promised, the chronic illness, this is June. And I'm going to refer to my notes here because I don't want to get anything wrong. So June is a 68-year-old woman. And she has a history she had a history when she came in of migraine headaches, urinary tract infections, joint pain, fatigue. I lost my place, sorry. Fatigue. The fatigue was so extreme she could only get around for an hour or so at a time. Then she had to rest a couple of hours to gain enough energy to be up and around again for an hour. And anxiety that this is going to be going on for the rest of her life. She'd had 20 years on and off antibiotics, immunosuppressants, and pain meds. Nothing really helped her. And the antibiotics were for recurring urinary tract infections. That's why she was off and on. And then one of the doctors she works with thought there was something infectious going on in her joints and tried several different kinds of antibiotics for that. Anyway, she had a friend who used to be very ill and worked with a naturopathic doctor and who seems to be like a brand new person. And she wondered if I could help her too. And she would have gone to the other naturopathic doctor, but they're not taking patients at the time she reached out to me. So she tried some natural stuff on her own. Some of it seems to work for a while and then stops. And she really just doesn't want to be on this roller coaster of meds and supplements for the rest of her life. It was just too overwhelming for her. So, like I do with everybody, before I booked an appointment for her, I spent about an hour talking about my approach to medicine, the vitalistic approach, and how it's different from a system she had been in her entire life. Because when people come and work with me, it's unlike, or any vitalist really, it's unlike anything they've ever done with a doctor before, because we're doing something different. We're not naming diseases and throwing drugs at it, or saying you need surgery, or we are saying, what are your symptoms telling us is not working within your body? Let's get that working and let your body self-heal. So we talked about how a body that is not being given what it needs to be healthy, or is toxic, or is being poisoned by various drugs, well, that body cannot possibly self-heal to the point where the symptoms go away, because there's still something wrong. She really resonated with the idea that her body could fix itself. She just had no idea what might have gone wrong, or how to start working with her body so that it would start healing again. So she scheduled an appointment. On her first appointment, it was about 3 hours long. We talked about everything. We talked about her childhood, her diet, trauma, places she's lived, her sleep, her exercise, and how much she moves around, her hydration, and just so much more, like lots and lots of stuff. And I ordered some tests because I wanted to evaluate her nutrition status and see if there were some deficiencies that might be present. I took a look at her foods. I wanted to know if there's something that she had a sensitivity to. I also got a urinalysis because UTIs were like, she always had a UTI. She always felt like she had a UTI. And as we went along in those 3 hours, I also took her homeopathic case. And the things that were really important to me in that part of the case intake was that she had experienced so many disappointments in her life from her parents, from other family members, from teachers, from friends, from a young age on into her adulthood. And the thing that struck me is she said, well, no one would know. No one in the world would know. Nobody knows but you that I feel this way and that these things have happened to me and that they've affected me in this way. There were a lot of other symptoms in her case that were important, but this was the main thing, a sense of a strong unfairness that she had experienced in life and many, many, many disappointments that she would just hold inside. And for my homeopathy buffs out there, she always had the desire to throw things. And if she was in a position where she could, she would feel better. It's an interesting symptom, right? And it leads us to the remedy. She drank a lot of caffeine and soda. She ate a lot of chocolate. She drank almost no water. She ate a lot of bread and tuna. She did eat salads once in a while, but really there was no other living or raw food in her diet. She was taking a basic Walmart multi and calcium supplement. And when I saw her, she wasn't on any medications, or I should say she wasn't taking any medications and hadn't for a while. So I sent her home with some lab tests and some lab orders because contrary to popular belief, naturopathic doctors can order labs. And we do. And I asked her to make a few changes. I must start people very slow and explain to them why they're making the changes that they're making and what I expect will happen, why I'm doing that. So I asked her to replace half her coffee and soda each day with water and add some lemon to that. And we negotiated that, right? I asked her to fill out a diet diary for a week so I could see the full sort of spectrum of what she was eating. I asked her to take an Epsom salt bath, which is magnesium salts, because I suspected there might be some magnesium deficiency given the fact that she really wasn't taking in any magnesium from her food. But I asked her to do that every night for the week, and I gave her a homeopathic remedy. What happened? What did we find out with the labs? Well, her magnesium was low, not where you get admitted for having such low magnesium, but it was lower than it should be. So normal is about 1.7 to 2.2. I won't give you all the little measurements that come after it. Hers was 1.2, so it was low. Her urine was clear. There was no urinary tract infection, even though she felt like she had one. There wasn't one. Food sensitivity test came back positive for gluten and dairy, and her vitamin D was very low. I think it was around 20 something. Now, on her first follow-up, her joint pain was 50% improved. Her fatigue had improved, not gone, not back to normal, but it was much better, the energy level. And she no longer felt like she had a UTI. And she said, oh my gosh, I can't even tell you how long it's been since I didn't feel like I had a UTI. That was all the homeopathic. And I know that because I've seen this over 20 plus years of people responding. The next 6 months we worked together. We got gluten and dairy out of her diet and replaced it with tasty alternatives. She gave up caffeine and pop completely. She had chocolate once a week as a treat. She learned how to stay hydrated. She did lots of water and lemon, and we came up with an herbal tea blend that she really liked. It was immune support and nervine and things like that. She started eating a piece of fruit, usually an apple, sometimes a banana every day. She added in some lean meat, some whole grains, freshly ground flax, non-heated olive oil, dark leafy greens, lightly steamed. She added in fiber every day. She came up with this amazing bran muffin recipe, and she would bring them every time I saw her. So she added fiber in. She probably was getting in some really good fiber, which is good. She took a magnesium supplement, and I used Calm. She liked liquids better than pills. Now, she also started a vitamin D supplement. I really like for people to get their vitamin D by going out in the sun, but not everybody has the luxury of time that they can spend in the sun. And some of the people I work with live in places where it's not really practical. So it was a combination. She did sunbathing every day and also add in hydrotherapy once a week for her. And I asked her, to start talking to people about her disappointments which she found easier to do after she started the homeopathic. In the beginning, she did a 10-day detox and then a 2-day fast every month. After that, she started yoga on her own and picked up meditation. And I'll tell you, this is what happened. What did we do? We gave her body what it needed. We moved toxins out. We stimulated her vital force. We got some support. We helped her shift her perception of getting disappointed and what to do with that disappointment. I didn't do all that. The therapies, the modalities did that. And then her body was able to start healing itself. So by month 7, she'd had no migraines for a while, no UTI symptoms. Her joints were pain-free. Her fatigue was completely resolved, but she liked to take a nap in the middle of the day, which I told her I thought was great. And she was feeling hopeful that the rest of her life was going to be very different from how it had been so far for as long as she could remember. What happened is her body returned to a healthy state, one where it was capable of healing itself, right? She was a different person that day she walked out after 7 months than she was when she walked into my office that first time. I still talk to her years later. So we did a lot of education and she just took off on her own. She was great. She was being her own best doctor, which I know we all can be. But I still talk to her on her birthday, and she continues to do well. And, I call her a case cured for sure. I think that weekly hydrotherapy is the pearl I'd like to leave you with today, as promised. You can do this for free at home to boost your body's immune system. There's a lot of benefits to this. It increases red and white blood cell count. It can break a fever. But remember, I'm not trying to oppose the body when it creates a fever. But we can support the body by doing this hydrotherapy. It's not going to make the fever go away if the fever needs to be there. But it has the potential to assist the body in getting through it and break the fever, which is really what we want to do. We want to let the body get as hot as it needs to for as long as it needs to and break that fever. It encourages waste removal, it encourages circulation, it decreases stagnation. So when would you use this therapy? Well, cold or flu symptoms, what you think of as cold or flu symptoms, which is the body detoxing, but let's stick with what you know. I don't want to get too radical on you here in the beginning. So cold or flu sets in, you would do it then. And if you do it soon enough, when those symptoms first come on, you can completely avert the cold or the flu, right? Meaning you're going to speed your body through that process, especially if you do other things like rest and take the appropriate homeopathic remedy, etc. Fever, it can be used to support a body through a high fever. Detoxification support, it can be really good when someone's trying to stop alcohol or smoking or pain medications. It can be really good. Now, keep in mind, there's a safe and effective way to do detoxification. We want to use therapies that take advantage of all of them and don't push things through one particular pathway. I'm going to be talking about detoxification next week on the Homestead Nature Cure. So we're doing all detox. Anyway, this particular treatment takes advantage of both digestive tract and the skin as organs of detox. So what do? I call this the wet sheet treatment or wet pillowcase treatment because it's a little bit modified from the original sheet wrap hydrotherapy. So you're going to wring out a pillowcase, a thin cotton pillowcase in cold tap water. Get it wet, wring it out really good. Spread a couple of blankets on a bed or a sofa, wherever you want to do your treatment. Take a hot bath or shower. It's really important because I want you to warm up your body first. It's good for this treatment to warm up your body. Lay down. Dry off, lay down. Put the cold, wet pillowcase on your chest. Some of it will get on your belly. That's fine. Wrap up in the blankets like a mummy and rest until that pillowcase has warmed up, or even better, has started to dry out. 20 to 60 minutes, you can lay there. Now, there's an initial warming. And someone can actually work up a sweat when they're going through this therapy. The temperature can go up, and it may be more or less the time that's needed. It depends on the person. But ideally, the best effect is going to come once the body has warmed up enough to actually break a sweat. But benefits can be seen even if it's shorter than that time period. And we want to be really careful. If someone's debilitated, very weak, elderly, very young, should not be pushed to that point of a major sweat. Just warming up the pillowcase is enough, and it's going to do a good job for them. But if you push them too far, it can be further debilitating. So that's my treatment clinical pearl for you. Next week, I'm going to talk about the power of preventative health. This is beyond reacting to illness, some foundational practices, how people can shift from a reactive to a proactive approach, why is prevention more cost effective, etc. Also, I have a case for you next week of a 35-year-old man with severe eczema and history of topical steroid use. He feels like recently he had been catching every single cold that comes his way, and takes him a long time to get better, and he really feels like 35 is too young to be going through that, and I agree. Thank you really for joining me here on Vital Wisdom. Hope you have a blessed week. I would be so honored if you'd share my podcast with the people that you really care about, and I'll see you next Sunday.